Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis, and it is the top cause of disability in the U.S. 20% more women than men suffer from arthritis, with the total cost exceeding $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you right now that the population of the U.S. did not double in that time frame. Almost 600,000 knee replacements are performed each year, and by 2030 that number could exponentially go up to 3.5 million replacements annually. 35% of those who get a knee replacement are between the ages of 50 to 69. That's a lot of years to ask a knee replacement to last when you get one that young. This is a quality of life procedure. It's elective. It should only be performed after considerable conservative treatment is received. And this may include over-the-counter non-steroidal anti-inflammatories, Tylenol, prescription pain medications when the pain is severe, not long-term, topical pain creams, physical therapy can help, and bracing. Even a cane can help too. For knee injections, there are several different types. The tried and true is cortisone. Then you have hyaluronic acid. And then regenerative medicine options are now mainstream, including platelet-rich plasma therapy, bone marrow aspirate-derived stem cells, fat-derived stem cells, and amniotic-derived stem cells. Let's go through those. Since the 1950s, steroid injections have been a mainstay of knee arthritis treatment. Initially, they were done for rheumatoid arthritis, and then a few decades later, it was noticed that they worked exceptionally well for osteoarthritis, so that's common. Today, they don't cure anything. They basically just are a band-aid for providing pain relief. It is questionable if they do any harm to the cartilage. There were some initial studies in smaller animals that did show some cartilage damage from steroid injections. Subsequent studies in larger animals showed no damage from cartilage cortisone injections, so it has never been proven. Studies show 75% good to excellent results with pain relief that can last months at a time. Then the injection can be repeated. They are the gold standard for knee arthritis non-operative treatment. Hyaluronic acid injections are the equivalent of motor oil. Hyaluronic acid is normally found in the synovial fluid of all of our joints. In 1997, the FDA approved the first HA preparation. It's made from rooster combs, and it's still made from rooster combs today. And the overall treatment is referred to as viscosupplementation. Whether you use a trade name like Synvisc, Orthovisc, Hyalgan, they're all pretty much the same. None of these have shown superiority in studies. One of the largest U.S. studies showed beneficial effects in 80% of patients for over 6 months. And the theory is that you're providing lubrication, the anti-inflammation qualities in the hyaluronic acid, and that it compels more cartilage to be produced. Platelet-rich plasma therapy involves a simple blood draw from the arm of about 30 to 60 cc's. That blood is then spun rapidly in a centrifuge, and the middle layer is concentrated platelets and growth factors that results. And that's what gets injected into the painful area, such as the knee. It may take 1 to 3 injections to get the best results. There's a recent study out of the Hospital for Special Surgery that showed 70% good to excellent results at 6 months. And that same study showed preservation of cartilage in over 70% at 1 year's time. Stem cell injections have the potential to alter the course of arthritis and not just to mask pain. They involve bone marrow-derived stem cell injections or fat-derived stem cell injections. Those are the ones that come from the patient, him or herself. Amniotic-derived stem cell injections come from consenting donors after a scheduled C-section. This has nothing to do with the fetus. This is fluid that gets thrown away after the birth anyway. It has a ton of stem cells in it. Who knew? And also it's immunologically privileged, so there's no rejection reaction. It goes to an FDA lab. And these are all mesenchymal stem cells. There's no embryonic, so there's no ethical concerns. For knee cartilage defects with stem cell injections, 6 months later the patient's clinical symptoms had improved, and these were maintained for over 2 years. No large clinical studies in humans have shown efficacy just yet, but there's been none that have not shown efficacy. They just haven't been done. There are a ton of small studies showing effectiveness of stem cell injections. The bottom line is that there are various types of knee injections available. All are low risk and outpatient. In combination with other treatments, they may help delay or avoid the need for knee replacement, and all these can be repeated every 3 to 6 months as needed. What we now know is that steroids are great and they can be very beneficial with low risk, but we now have treatments that can offer alterations of the course of arthritis. They can help restore some cartilage and some of the tissues that have been degenerative and lost. The top pain management clinics in the Colorado area of Denver are Colorado Pain. They have several locations in Metro Denver, including Buena Vista, Golden, and South Granby. They accept over 50 insurances with the board-certified pain doctors who provide both medication management and all the interventional treatments discussed here. The number to call for treatment is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.